We have a couple of rapid fire questions for you, doctor. So I'm going to start with the first one. Any screening for liver cancer?
Yes, sonography and a blood test for hepatitis B and C.
Okay. All right. What are Indians doing right or wrong when it comes to a diet?
Majority Indians are vegetarian, that's right. But many Indians are also eating a lot of fast food, not giving time to eat their food properly and taking a wrong diet. So that is something which is wrong.
Okay. Well, what is the healthiest type of diet you would propagate?
A properly balanced diet which is containing predominantly millets instead of wheat, then preferably avoiding milk, but taking altered milk products like curds and buttermilk, and making sure that you eat sufficient amount of fruits in between your meals, not during the meal or immediately after the meal, and 70% of your diet should contain good leafy green vegetables.
Okay. All right. Is IBD, which is irritable bowel syndrome, linked to lifestyle or genetics?
It can be linked to genetics, but it's predominantly immune system related. So these are because of environmental toxins, and it's because of the changing environment which we are going through, and that is the reason we are seeing more and more IBD on the rise.
So what are prebiotics and probiotics?
So prebiotics are good type of food which will enhance the growth of good bacteria, the good commensals. And probiotics are actually good bacteria in a liquid or a capsule format which we ingest to increase their population.
So does it help taking probiotics every day? What do you recommend?
Yes, there is no harm in taking probiotics. They will not cause any harm, but that will maintain a good milieu, a good atmosphere of bacteria in the gut.
So can you get enough probiotics from food, or do you need to take supplements when it comes to probiotics?
A properly balanced diet will give sufficient amount of probiotics, so you don't need to take probiotic supplements. Very simple thing like even simple pure ghee that contains a tremendous number of probiotics.
What are the foods that help tackle acidity, a problem that you commonly see amongst your patients?
So tackling acidity is foods like cucumber, like tomatoes, or like avocado, or like melons. Such type of foods are definitely they tackle acidity because they neutralize the acid. In fact, most of the fruits that we eat except the citrus fruits are alkaline in nature. So if you eat fruits in between, then definitely your acidity can be tackled, and not to fill your tummy too much. Always fill lesser than your capacity.
Okay. And is the overuse of spice linked to gut diseases?
Not exactly, because spice directly doesn't cause any damage to the gut. Unless the gut is already inflamed and you eat spices, then you have trouble.
Okay. Linkage of overuse of antacids or antacids to cancer?
No direct linkage. Antacids in a syrup format has got absolutely no side effects, but acid reducing medications can sometimes lead to problems like osteoporosis. It can lead to some vitamin deficiencies, and rarely theoretically it is supposed to link to cancer, but there is no proved data on that.